Hi everyone! Welcome to episode 9 of the Two Hands, One Heart Life Skills series. I am Jordan Welker, Miss Roanoke Valley's Outstanding Teen 2020. If you have not watched episodes 1 through 8, please watch those first to be able to accurately follow along with the series. As always, I want to reiterate that I am an American Red Cross licensed CPR, AED, and first aid instructor, and this online series is not a formal certification course. My intent behind these videos is to give you a skill to practice and learn if you are in a situation where you may need to use this knowledge. This week's episode is all about choking. We'll cover what choking is, how it can occur, how to recognize it, and how to care for it. Choking occurs when the airway becomes either partially or completely blocked by a foreign object, for example, a piece of food, a small toy, or body fluid such as vomit or blood. So, what are some risk factors for choking? Eating while talking or laughing, or eating too fast, medical conditions such as neurological or muscular disorders that affect the person's ability to chew and swallow, dental problems or poorly fitting dentures that affect the person's ability to chew food properly. Choking is a common cause of injury and death in children younger than 5. Very young children explore by putting things in their mouths, which increases their risk for choking. Children younger than 4 often lack the skills needed to chew certain types of foods thoroughly. Now, what foods and objects can be choking hazards for children younger than 4? Some foods include small foods such as nuts, seeds, and popcorn, round firm foods such as hot dogs, grapes, and hard candies, sticky foods such as peanut butter, chewing gum, and gummy candies, large foods that break easily into small pieces such as teething biscuits and cookies, chunked foods such as fruit, raw vegetables, and meat or cheese. Objects that could be hazardous include small round objects such as coins, buttons, button batteries, magnets, beads, and vitamins, small metal or plastic items such as toys, jewelry, safety pins, pen or marker caps, and the pull tabs from soda cans, plastic bags and deflated or broken balloons, and baby powder. You can identify someone who is conscious and choking because the person will not be able to cough, cry, breathe, or speak. A person's choking will usually give the hand signal that they are choking by grasping at their neck. So, how do you care for someone who is choking? The first step is always to obtain consent. No care can ever be administered without the consent of the person or parent/guardian consent in the case of a child. After consent is obtained, you will want to have the person bend at a 90-degree angle with your arm under their chest, supporting their body. In this position, administer 5 back blows. These back blows should be in between the person's shoulder blades, with the heel of your hand. After 5 back blows, stand the person up and perform 5 abdominal thrusts. To perform abdominal thrusts, stand directly behind the person and locate their belly button. Once this is found, place your hand in a fist position just above the belly button with the other hand on top of the fisted hand. After you're in the correct position, perform 5 thrusts and monitor if the object becomes dislodged. If the object does not dislodge, repeat the 5 back blows and 5 abdominal thrusts until the object dislodges, the person can cough forcefully or breathe, or the person becomes unconscious. Thank you so much for watching this week's episode of the Two Hands, One Heart Life Skill series. If you have any questions, leave me a comment or send me a private message, and I'd be happy to answer you. I hope to see you next week for episode 10. Stay safe and save lives.